Tooth decay, which is also known as dental cavities in young children's teeth, is on the rise in the United States according to the largest governmental study of the nation's dental health in more than 25 years. There are many reasons that this is occurring, but before we discuss the reasons, we will examine how a dental cavity occurs. We now know that tooth decay is an infectious disease. Dental caries, the disease process that leads to tooth decay, is transmissible oral infection. The bacteria that cause dental cavities can be passed from parent or caregiver to child and from sibling to child. If you took your fingernail and scraped it against your tooth right now, you would most likely see a white gelatinous material on your fingernail. This white gelatinous material is dental plaque, which is the bacteria that causes tooth decay, and that is where that bacteria is found, in dental plaque. In order for a cavity to occur, the three things in this slide must be present. These three things are a tooth, bacteria, which is plaque, and sugar. The damage to the tooth begins when the bacterial plaque comes in contact with foods high in sugar and other carbohydrates. The bacteria ingest and break down the sugars, producing acids. The acids attack the outermost hard surface of the tooth, also known as the enamel. After many acid attacks, tooth decay may occur. The hole in the tooth created by the acid attack is referred to as the cavity. If the tooth decay bacterial infection is not stopped and the cavity filled, the cavity continues to get larger, extending through the enamel and into the dentin of the tooth, and eventually into the pulp tissue of the tooth, where the blood vessels and nerves of the tooth are located. Unfortunately, a tooth cavity does not get better on its own. This bacterial infection can then spread throughout the jawbone and through blood vessels to other parts of the body and face.